This week, Minnesota's election campaigns head into the home stretch, and a few Republican senators are having second thoughts about the Rural Health Transformation Program. Welcome to the August 14th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. What may be some of the toughest political questions of this year's election got settled this week as Amy Klobuchar won the DFL nomination for governor and Republicans picked GOP House Speaker Lisa Demuth to run against her. Lieutenant Governor Peggy Flanagan will face former sports broadcaster Michelle Tafoya for the state's open U.S. Senate seat. Healthcare has played only a fleeting role in the campaign so far, with issues like immigration enforcement and Medicaid fraud dominating early debate. DFL gubernatorial nominee and U.S. Senator Amy Klobuchar, however, did address the issue within hours of her Tuesday victory in an interview with Fargo-based Valley News Live, which broadcasts into northwestern Minnesota. She said healthcare affordability would be a focus for her administration if she won.
Bringing down healthcare costs by making sure that people are out there on the individual market, which is a lot of our small businesses and farmers, that they get a tax credit, which we used to have, for their insurance premiums to help them defray the cost. And if they're not going to do it in Washington, they might at the end of the year, but if they don't do it, we're going to do it in the state of Minnesota like 10 other states have done.
Flanagan has also said she would make Medicare for All a priority if she wins a Senate seat. There was some other news in Washington as well this week. The Trump administration stepped up its efforts to curb gender-affirming care with a new report alleging Medicaid funds had been used improperly to provide that care to minors in dozens of states. The report was accompanied by a letter asking the HHS Inspector General to examine reimbursements to dozens of U.S. providers for alleged fraud connected to that care. Those providers included a half dozen Minnesota healthcare providers. The report and referral came just days after the Trump administration said it would ban any Medicaid funding for gender-affirming care for anyone under the age of 18 starting in mid-October. Those reimbursements amounted to about $31 million of $924 billion in Medicaid and children's health insurance program spending in 2023. Also this week in Washington, two key GOP senators were expressing new reservations about the Rural Health Transformation Program, the key element of the One Big Beautiful Bill that helped win a Republican majority for the measure last July. Alaska Republican Lisa Murkowski told health news outlet Modern Healthcare that she now believes that the $50 billion RHTP program will not fill the gaps that open in healthcare finance as work requirements pair Medicaid reimbursements across the country. She cast the decisive swing vote on the bill among U.S. senators. Also, Maine Republican Susan Collins, who helped frame the RHTP, said in a letter to Medicaid administrators that she believes there is, quote, real risk that the funding may not reach the frontline rural providers that communities depend upon most. But Kansas Republican Senator and physician Roger Marshall told Modern Healthcare that it was a lie that Medicaid cuts posed a threat to rural hospital care. And finally, President Donald Trump on Monday signed an executive order preempting CDC vaccine recommendations and rolling out his own. Trump said the order reduces some recommended shots and delays measles, mumps, and rubella vaccinations.
You have the MMR. We want it in 3 separate vaccinations, given at separate times. Together, there could be a possibility they're quite lethal.
The CDC has said MMR vaccinations are safe for most people and safer than contracting measles, mumps, or rubella. Health experts and even physician and Republican U.S. Senator Bill Cassidy called the order wrong. The order comes as the U.S. is reporting the most measles cases in a generation, and Minnesota has among the lowest vaccination rates for kindergartners in the U.S. Non-medical exemptions let the number in the state fall to about 86% last year, well below the 95% threshold recommended for herd immunity. That's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. Thanks for listening.